It was a chaotic weekend, I think it's fair to say. A chaotic weekend across the country on the COVID front. In the meantime, of course, in WA, we relish our freedoms behind our hard borders.
Perth is one of the few places in 2021 Australia that looks like the rest of the country looked before a global pandemic hit our shores. And the state's Premier, Mark McGowan, wants to keep it that way.
Which is no restrictions, prosperity, jobs, a healthy community, and Western Australians enjoying one of the freest and safest lifestyles of anywhere in the world.
On Thursday, WA will effectively seal itself off from New South Wales completely and indefinitely.
They've had insufficient measures in place. If they put the right things in place back in June, I suspect they'd be out of it now.
But Mark McGowan's hard line on eliminating COVID and keeping it out is now at one end of a spectrum of positions held by the federal, state and territory governments about what the ambition of our COVID policy should be, as well as the reality of what they can actually achieve. There is a roughly political divide among leaders. Labor states and territories are continuing to pursue something close to elimination, or at least strong suppression. But there were 714 of 818 cases under investigation in New South Wales today. With its contact tracers clearly overwhelmed, the Berejiklian government appears to have given up on what is known as COVID zero, instead saying vaccines are the only path out and dangling new freedoms for the vaccinated.
You can't keep Delta out forever. You can't assume there'll be zero cases, even if you've had zero cases today.
Well, zero COVID, I think, has a broad understanding in the community of there being no COVID in our community. But some people also mean elimination of COVID. And no, it's not actually the policy. We've had a suppression policy in Australia.
Epidemiologist Tony Blakely has been delving into the data coming out of the New South Wales outbreak and modelling how long it would take to effectively eliminate the virus with lockdowns.
And even for the hard lockdown, it takes till November before you get back down from that situation to 5 cases per day, i.e. what you would consider to be an elimination strategy point for opening up.
But perhaps more significantly for the current debate, he says pumping extra vaccines into the state has limited value as a short-term tool to stop the spread.
And it helps a bit, but not too much, because it takes time to get jabs and arms twice and then your body to give an immune response. So the vaccine strategy is brilliant for medium and long term. And of course, we need to be doing it. But it wasn't able to help turn things around quickly in New South Wales.
An ambition to get to 70 to 80% of the population vaccinated before the economy is opened up, or at least not locked down, is the plan adopted by National Cabinet based on modelling from the Doherty Institute.
This is using mathematical models to say what would be the implications if we had COVID in our community. What would we see in terms of people in hospitals, in terms of people in intensive care, and sadly, a small number of people dying.
And I think the national plan is excellent, but we will need to tweak it as we move on. And we've learned even since the Doherty modelling that this virus is more infectious amongst children than we might have thought. So what that means is when you get to 70% of only adults, or about 55% of the entire population, you just can't open up because it'll go crazy.
And that brings us to the political problem, when the latest outbreaks have been conspicuous for the number of children infected. With no approved vaccine in sight for children under 12, and one for those over 12 still to be approved, it is and will be a political problem and blockage to the economy reopening. And the problems, political and otherwise, are not just about access to vaccinations, but the growing economic and mental health toll that lockdowns are taking, and the increasing resistance to lockdowns, which may be rendering them less effective.
We know that Lifeline have been having record-breaking numbers of calls from people who experience really severe mental distress. So finding a middle path where we protect lives, we keep pressure off our health system, but at the same time enable people to actually make a living and then actually care for their mental health, I think that's going to be where we all have to be aiming for. That's the sweet spot we need.
Tony Blakely has been and remains a firm supporter of Victoria's hard lockdown strategy until now. But he has new modelling on the Victorian outbreak and what should happen if the current lockdown does not manage to bring the outbreak under control.
If by the 2nd of September we don't see the daily infections down to 5 or less, we will have to consider our options because we won't have successfully re-eliminated, and it's looking like we might be heading that way.
He says at that point it may be time to consider a softer lockdown rather than extending the hard one further.
We'll let people start visiting each other a little bit at home. We'll let more essential industries back. We'll allow people to move 10 kilometres. We'll take the curfew off. I'm not saying it's the right option. I'm just putting it out there for discussion.
For the Prime Minister, the problem is actually trying to get some consensus among the states.
We've agreed a national plan at 70 and 80% based on the best possible medical advice. We have been told very clearly that lockdowns, once you move past that level, come at more cost than gain. We have to deal with it. Otherwise, we stay in the cave forever. And that's not a sustainable solution.
In the past couple of days, the federal government has been waving a stick, warning it may not provide financial support to states that go into lockdown once we reach 80% vaccination.
It seems a little odd that by next year, early next year, potentially you might be able to fly from Sydney to Los Angeles, but you can't fly from Sydney to Perth. So I do think it's time for maybe some very honest talking about what we think we can achieve and then when we can achieve it, so we can all stick to that. And if nothing else, Laura, I think it's very confusing for people listening to these very mixed messages. But yes, we've got a way to go before we have agreement amongst the states and territories. Well, we did think we had an agreement, but it doesn't look like that just at the moment.
There are new variants of COVID politics sweeping around the country. Whatever the public health arguments, the conflicting and changing messages can only compromise and confuse public confidence in the pandemic response. That makes the prospect of us being able to spend 2022 living like they are living in the West right now that much more remote.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.